So is my screen visible? And a few participants were complaining that audio is not clear and there is a echo. Am I okay in context of voice and slide sharing? Okay. Thank
Yes,
you.
ma'am. Screen visible, voice clear.
Okay. Thank you, Naveen. Thank you, Akshita. Thank you, Vicky, and thank you, everyone. So today webinar is on sample size calculation on case control study. So on the last webinar, we did on the cross-sectional and today is the case control. So I'll be discussing briefly on the case control study design and then we'll see how to calculate the sample size. So this entire session, we have focused mainly on the unmatched case control study because the sample size calculation for the matched case control, I'll be touching briefly towards the end because the input for a matched case control study generally you will not find it in the past literature. But again, with few assumptions, you can use those assumptions for calculation of a sample size for matched case control study. So let's discuss some basics of study design with the context of case control study. So if my research question is, does the type of learning technique affects marks gained in the final professional exam? So my research question is, rather my objective is that to determine the effect of different learning technique. And in this context, like maybe you can test versus people who have taken the marrow and prep ladder versus people who are following the traditional books over those active learning in context of the app-based learning. And then you see their performance in the final examination. So if I want to conduct, if this is my objective, I can conduct this study through 3 different approaches. And you have to answer in the chat box type of study used in all 3 different approaches. So like this is my first approach. So what I did, I have taken a group of students and I have categorized them as group of students using Marrow Prep Ladder, that means active learning, and group of students falling into the traditional learning. So like, sorry. So this is the one group which is following the active learning, that is the app-based learning, and second is the traditional learning. Now I want to see what is the outcome in this case. So if I follow them up and see the outcome, then the outcome is determined on the basis of pass and not pass. Maybe you can have some other outcome like distinction or more than 60% and less than 60%. Here I have just kept it simple like pass and not pass. So if you have outcome in this form, so which type of study is this? So initially this is the exposure. And then I have followed these people and then I have seen the outcome. So Shobha, Ramesh, Subhashis, everyone is writing cohort. Yes, perfect. Now coming to the second.
Ma'am, sorry to interfere. Ma'am, are you changing the slides, ma'am? We couldn't see.
Yeah, can you see this?
Yes, ma'am. Now we can see. Yes,
Actually, initially there was a lag because when I pressed to the next slide, it did not happen. So maybe that's why you got confused that I'm not changing the slide. Sorry for this confusion.
Thank you, ma'am.
So yes, now coming to approach 2. In this case, you can see that there is these are the 2 year, 2020 and 2022. So what I did in 2022, I have just taken the students who are passed and who are not passed. So what I have done, I have categorized these 2 groups on the basis of outcome. And then I have gone back in 2020, 2 years back, and I just categorize them in the 2 groups like people who are using the active learning and people who are using the traditional learning. So which type of study design this is? If I use this method to assess my research question or to check my research question using the objective, which type of study design this is? So this is a case control study. Yes. Now coming to third approach. So in this case, you can see I have got two calendar here, 2020 and 2022. So what I did, I have got this database of people who were using the Prep Marrow, these active learning app, and the other group was not using it. So I have categorized it in the two groups, and now maybe you can take it 2022 or 2024, and then I see whether they are pass or they are fail, depending on the mode of learning used, whether it is a traditional learning or whether it is a active learning. Then which type of study design this is? Can you show me the text messages? Retrospective case control. So because case control is already retrospective study, so we generally don't use this term retrospective case control. Do you want to modify your answer? Yes, Dr. Ramesh is writing retrospective cohort. So you are right. Longitudinal, generally we say yes, it is a type of longitudinal, but to be more specific, because once you say longitudinal study, all that follow-up study comes into this longitudinal. So yes, Dr. Arya and Dr. Ramesh is right in their statement that it is a retrospective cohort study. In the retrospective cohort, basically, don't get confused this with the case control, because the classical difference between the case control and cohort is how you start. So if you start from cases or outcome and then assess the exposure, then it is a case control. First, you select the cases, and then, as the term say, case first and then control. In case of a cohort, whether it is a retrospective cohort or a prospective cohort, you always start with the exposure. So if you start with exposure, classify individual based on exposure, and then follow it up, then it is a cohort. So in retrospective, basically what you are doing, if you don't have time and you have got the database where you can divide the individual or classify the individual based on their exposure status and then determine the outcome. Now, so by adopting a retrospective cohort, you can decrease this calendar time, means that reference you can skip, and it is easier than the prospective cohort, because a prospective cohort takes a lot of time and energy and resources. So in that context, a retrospective cohort is a much easier study design. So these are the three types of study design if you want to test this objective or this research question, depending on the type of learning method used, and the outcome is whether the student get more than 60% or more than 75%. Here we have used the pass or fail. So yes, one more example. So if my research question is, does antenatal care affect birth weight? So here I have measured the antenatal care using the number of antenatal checkups done, and birth weight I have categorized as a low birth weight and a normal birth weight. So to determine the relationship between the number of antenatal care visits and the risk of low birth weight in newborn, we have conducted this. Again, we can conduct this study through three different approaches. So first approach is, we have recruited the antenatal women and classified them in having less than 4 antenatal visit and more than 4 antenatal visit. And then I have followed them up to observe the outcome, and then classified the outcome as having the low birth weight or a normal birth weight. So which type of study design this is? Yes, all of you please write in the chat box. So this is a cohort study, because we have started with the exposure, and the exposure is the women having less than 4 antenatal visits, women having more than equal to 4 antenatal visits. This is the second approach. What I did in this approach, in 2022, I had a register and I have just classified the individual or the women on the basis of number of antenatal visits. So I have made 2 exposure category, less than 4 antenatal visits and more than equal to 4 antenatal visits. And then I have seen in 2023 or 2024, the current status, I mean, based on this history, again, I can take from the records also, or because it can be done as a record based. And then I see the birth weight of babies. So which type of study this is? Where I am classifying the individual based on the exposure status way back in the calendar time. And I'm assessing the outcome currently. So yes, I think I'm getting mixed sort of response. Few people, I think Dr. Arya has written the prospective, otherwise less, or everyone has written the retrospective cohort. So yes, it is a retrospective. Again, in retrospective, remember, we always start with exposure. Whenever we are starting with exposure, one thing is clear, that it is a cohort study. Now, the next question will come like a prospective or a retrospective. So prospective, when you are assigning the exposure status now, currently, and then following it up in the future, then it is prospective, as the term suggests. The retrospective, when you are assigning the exposure way back in calendar time and assess the outcome later, maybe today or 1 year back, then it is a retrospective. So depending on the assessment of exposure and the assessment of outcome, it is the entire crux of classifying a study as a prospective cohort study or a retrospective cohort study. And this is the third approach, when I have like recruited the low birth weight, taken the low birth weight babies, and I have classified and taken the normal birth weight also as a control. And then I have followed it up, and I have seen I want to measure, or I have classified the exposure status as having the less than 4 antenatal visits or more than equal to 4 antenatal visits. And then I calculate the measure of association, which is the odds ratio. Then it is a third type of study, which is a case control study. So yes, you are, all of you are right. Most of you have labeled it correctly. So whenever we select the participant based on their exposure status, it is known as the cohort study. It can be a retrospective or prospective, the way we have seen. Whenever we recruit individual based on the cases, based on the disease status or outcome, and then we select a comparative group, then we call it as a case control study. And in case control study, since the disease has already happened or the outcome has already happened, so we cannot calculate the incidence. So the measure of association is the odds ratio, whereas in case of the cohort study, the measure of association is the relative risk. Now, since we have said that odds ratio is important in the calculation of sample size, and we'll see how odds ratio is important. So many of you know regarding the type of odds ratio. So there is something known as the adjusted odds ratio, and there is something known as the crude odds ratio. So if I'm using the sample size, if I'm using the odds ratio as an input method, which odds ratio should I take? Should I take the adjusted odds ratio, or should I take the crude odds ratio? Yes? Please answer in the chat box. Okay, so Dr. Bhaskaran is saying the adjusted odds ratio. One person is saying either A or B, crude odds ratio. So basically the answer is the crude odds ratio. Why crude? Yes, Dr. Ritvik Mishra is right. It's the B. Why B? Because see, adjusted odds ratio, it will keep on changing depending on the factors which you are saying, which you are taking. So depending on the level of model, because adjusted odds ratio are different in various level of like model 1, model 2, model 3. But crude odds ratio is fixed. And in most of the case control study, there is a one exposure and one, you can say the exposure and the outcome. So you take the crude odds ratio. Why? Because depending on the number of confounders and the level of number of model, your crude odds ratio, your adjusted odds ratio will keep on changing. So you don't want to measure a sample size on something which is changing. So that's why you use a crude odds ratio, not an adjusted odds ratio for the calculation of sample size in a case control study. So just in midway announcement, since many people leave in between, so our next sample size calculation webinar is on 8th of October from 2 to 3:30 p.m. So the like we have seen that it is a case control study. So the first word is case. So we first select the case whenever we do a case control study, and then we select a control depending on whether it is a matched case control study or an unmatched case control study. So what is the need of a case control study? Although in the level of hierarchy of evidence, you will see that case control lies much below the randomized control trial and the cohort study. It's above the cross-sectional, but below the randomized control trial and the cohort study. So why there is a need of case control study? So as you or many of you have read that it is usually done for rare diseases or the rare outcome. So what happens that many times in medical science, like it is not always, you don't have that much time always to do a prospective study since the or a clinical trial, because in clinical trial you have, although it is an experimental study, so you have to subject that individual with intervention. And in a cohort study, if the disease takes a lot of time to develop or the outcome takes a lot of time to develop, then the investigator might not have patience to follow up those individual for that long, or maybe that fund and resource issue might be there, and there is sometimes there's a loss of interest also of the researcher. So to take those factors into account, case control study, you can say that it's a easier study to do, and that's why many times for an initial, like after cross-sectional study, for an initial evidence generation, especially in the case of outbreak investigation, you will see that the case control study is a very apt way of measure the association between an exposure and an outcome. Because in outbreak, generally what is happening, we always see that there's a food poisoning or there is some disease outbreak has happened. So you see the exposure level, what is the risk factor, and then since outcome has already happened. So that's why in outbreak investigation, you will see that case control study is the most common type, because that's the only way you can determine the strength of association in the form of the odds ratio. So that's why it is a very useful method to prove the association between the exposure and an outcome. Like in this case, in this example, you can see if I want to see the association between a high fat diet and the cancer, colon cancer probably. So high fat, then I cannot expose the individual to the high fat diet because I know that it is unethical. So because of the ethical reason or because of the long term follow up, it is a wise decision to go for a case control study. Similarly, for this research question, if I want to see the association between the childhood sexual abuse and psychiatric disorder or depression in adulthood. So if my research question is this, then definitely case control study will be the best way to prove this association, since the exposure has happened in the childhood and the outcome is happening in the adulthood. Similarly, with this this hypothesis of fetal origin of development of disease. Again, you know that low birth weight people, and through that case, low birth weight leads to this diabetes mellitus. So you can do a case control study for recruit a group of people and number of cases having diabetes and not having diabetes, and then see whether they were low birth weight or normal birth weight. And then you can see whether low birth weight is associated with development of diabetes in the later life. So such exposure which is there in the childhood and there is a link to the some onset of disease in the adulthood, case control is the ideal way to to prove the association or to refute or prove a hypothesis. Again, the same question, the association between the colorectal cancer and the prior antibiotic prescription. Again, this is a research question where through case control study, you can prove the association. So it is an alternative to the clinical trial or cohort study. So basically, you can do either a retrospective cohort if you have got a good database, and if you can classify the individual based on exposure status, then you can go for a retrospective cohort, or a case control study when you have the cases. So you can recruit the control group, and then it can be done taking the exposure history based on record or based on recall. So it can be a record or a recall, and then you can do a case control study. So the association between the outcome and the exposure is measured in case of a case control study in the form of a odds ratio. So a few slides on odds ratio. I know all of you know this, but just many times we get confused with odds and the odds ratio. Since every time, like if I ask you the question, what is the odds of CVD, that is the cardio. So in this 2x2 table, what you can see, this is a 2x2 table of cardiovascular disease status, where I am showing the gender. This is male and I have classified gender as male and female. And this cardiovascular disease status, you can see like present and absent. So if I ask this question, what is the odds of CVD present in male? Then what will be the answer? Yes, can you show me the messages? So it is 9. So how you have decided like 9? I am not, that's what I said, that initially we get confused. So all of you are answering odds ratio. Odds ratio is AD by BC. So what you people did, 6 into 3 divided by 2. But my question is not odds ratio. I have asked odds of CVD present in male. So how will I take out? So it is 3. Yes. Right. So how I'll take? I will only consider this male. So I'll focus on this. Because I am not going to see the female row. I only have to see the male row. So I'll focus on this. And how I'll take it? They take out present. I have to see the odds of CVD present in male. So odds of how do we define odds? Odds is the occurrence of something in the numerator and in denominator not occurring. So present is 6 and absent is 2. So what I will do, 6 by 2, which is 3. Similarly, if I ask this question, what is the odds of CVD? Just a sec. I'm changing the slide. Still, I have not changed. What is the odds of CVD present in female? Then what is the answer? If my question is odds of CVD present in female. Yes. So Dr. Ghodke is right. 1 by 3, or Abhit is also okay. 0.3. Yes. Now if I ask the odds of CVD is how many times in male as compared to females, then you can, if I ask this question, odds of presence of cardiovascular diseases, how many times in male, as taking female as a reference. So in that case, you have to divide the former odds with the later odds. What was the former odds? 3. And the later it was 1 by 3. So what I will do, 3 divided by 1 by 3. So it will be 9, which you guys initially said that it will be 9. So odds ratio will be 9. Similarly, if I ask this question, what will be the odds of CVD in female, taking reference of male? Yes? Can you show me the chat box? So 9 and 2. This will be the 9 will be the odds of CVD in male as compared to female. What will be the answer in this? Yes. So Dr. Swati is right. Dr. Abhit is also right. It will be just the reverse of the previous one. 1 by 9. So this is just to revise the difference between the odds and odds ratio. Now, now coming to the basics of calculation of sample size. So in a case control study, we always say that although that is an epidemiological perspective, but the selection of control is the most important part in doing a case control study, because cases you have, but how you select a control, because we say that the selection of control should be from the disease exposure status should be very much similar in your control as it is there in the general population. So you know that there are problems with the hospital control, and if you select one control also, there are problems. So we have to see a sample size depending on our exposure status and depending on our research question. So there are a few issues which are important. So odds ratio, this is a very important input for calculation of a sample size. So how do we define odds ratio? If the odds ratio is 1 or very near to 1, let's say 1.2 or 1.3 or 1.1, what will you say? Is it a strong association or a weak association? Yes? if I say, let me see the chat. Yes. Okay, weak. So now generally what do we say? If there is a weak association, sample size will be more or less. Yes, so Dr. Ramesh is saying more than 2 is strong or more than 1 is strong. So the lesser the odds ratio, lesser means lesser, I mean, it near to 1, then the sample size requirement will be high. The next important thing is the proportion of population exposed to the risk factor of interest. That means, what do I mean by proportion of population exposed? Means generally my control should be selected in such a way that the distribution of exposure in my control should be representative of the exposure status in the population. That means my control should be very much representative of the general population. Then only I can say that I have achieved the, measuring the exposure status as near as possible. And then again, the third thing which is important is what is statistical significance, what the level of like alpha and beta we have set in. Generally, we set alpha at 5%, alpha and beta, that means power and alpha error, we have discussed in the cross-sectional study. But you know that alpha is generally, how do we define alpha? Alpha is the type 1 error rate. So basically, you decide this confidence level. So you set the confidence level at 95% or the alpha error, which is a type 1 error, at 5%. You don't allow of alpha error more than 5%. You can calculate it at 3% and 1% also. And power is generally the capacity to detect the difference. So basically, if you say that power is 90%, that means you are 90%. That means your study yield will be good. That means your beta error. So how do we define power? Is generally the 100 minus beta error. And beta is the type 2 error. So these levels we fix the alpha and beta level, and that is important input for the calculation of a sample size in case control study. So coming to the assumptions and the adjustment. So generally in the case control study also, in the cross-sectional study also, we have seen that there you can have any outcome as a proportion, or you can have it as a continuous, which is the mean. So if you want to take this proportion as input, how will you take? So generally you take the odds ratio. You need two input. We will see in the statue later. So you need two input, odds ratio and the proportion. And you need also alpha level, alpha error, which is 5%, and power, which is usually we keep it at 80%. And then you can do the adjustment. So adjustment can be done in the form of a response rate or in the form of clustering if it is there. Similarly, if you want to compare two means, then you should have standard deviation, generally which is the pooled standard deviation, and the mean difference between the cases and control. So here you have got two groups. There is a case and there is a control. So you should know the, for a proportion, you should have odds ratio in one, taking the reference as the other category. And then in the second one, you should have a mean difference if it is a continuous outcome, and the pool standard deviation. And adjustment you can do in the form of a design effect. We have discussed the design effect, but generally case control study, generally it is done as a hospital-based case control study. So if you are taking a multiple hospital, then you can go for design effect, because then there might be clustering. But if you are doing a single hospital-based case control study, then this design effect will not be applicable. And then response rate, if it is required, if you, I mean, in this case, if you see that, you will not get exposure status, or there will be people who will not be telling you the based on the exposure status, their history, then you can take the response rate. Now coming to the impact of odds ratio on sample size calculation. So this is one graph you can see here. There's a graph, there's an x-axis and there's a y-axis. So if you see this is your y-axis and this is your x-axis. So x-axis, basically the odds ratio is there on x-axis, and on y-axis it is the sample size requirement. So if you see the sample size requirement, if you see this graph, remember it is a graph like this. So, and this starts from 1. So at 2, if you like match this line, so at 2 you will see that this line goes here. Let me. This, and if at 1.5, if you like match this, it goes much above. I have not drawn a very straight line, but what do I want to convey by this graph? That the sample size, smaller odds ratio, the way we have discussed before also, that if the odds ratio is close to 1, that means your sample size requirement will be very, very high. You can see here, the sample size requirement is near 600 and above that. And to detect the small difference, you need a larger sample size. Similarly, you can see that there are two odds ratio, 1.5 odds ratio and 2 odds ratio. So there is a difference of only 0.5. But a study designed to detect an odds ratio of 1.5 will require a sample size about 3 times. If you see this, you require a study design, a sample size approximately 3 times larger than in a study where the odds ratio is 2. So this is a very important thing to remember, that odds ratio, and if you see that odds ratio falls down, sample size requirement increases sharply if the odds ratio, if you see this, 2.5, generally they have put a cutoff of 2.5, that below 2.5, the sample size requirement increases very sharp. So you can just see the value of odds ratio in calculation of sample size. And you should remember that 1.5 and 2, there's a difference of 3 times sample size calculation if the odds ratio is 1.5. This is one example where you can see that what you can see here in this case. Yes, you can see that there are two 2x2 table. So these are the cases of the diarrhea. And we have taken 2 risk factors. The first risk factor was water supply, and the second risk factor is the domestic hygiene. So this was an actual study which was done. And you can see here, what you can see here in the first case. Let's discuss first this water supply and diarrhea. So cases are the cases of diarrhea and controls are the controls. Means the cases who are not suffering from diarrhea. So what can you see here? Is it showing a statistical association? This p.2 odds ratio of 1.5. The odds ratio is 1.5, but the p-value is not significant. Similarly, the same number of sample size is here in case of a second risk factor also, which is the domestic hygiene. But here the risk factor is, here you can see the odds ratio is 2 and it is significant also. So now what difference you can find out in this? Please write in the chat box. Can I see the chat box? Yes. Why there is a difference in statistical, this p-value, even when our sample size is same, 200 cases here also and total 200 here also. Why is this? So the question is, why does the association between the domestic hygiene and disease appear statistically significant, while water supply, despite having the same sample size, shows no statistical? So here the answer will be again in this odds ratio. So odds ratio in this case is 1.5 and odds ratio in this case is 2. So to detect a difference of statistical significance of this 1.5, it needs a 3 times larger sample size. Means how much sample size is needed in this case so that it will be significant? The way we have just learned, if there is a decrease in the 0.5 of odds ratio? Yes. 600, 3 times. So if you take the 600, now again, this is another question. How will you take a 600? So you have to take total of 600, means you have to increase the, like it's 100 here. So maximum what you can take, we'll learn this later. If there is 100 cases and you cannot increase the number of cases since cases has already happened. So then how you can achieve the 600? Is it possible? Since the cases, like let's say in outbreak investigation, the cases are already there. You cannot increase the number of cases. But if the odds ratio is 1.5, you have to make it 600. So how it can be achieved? Just retrospective cohort, more sample size. Yes. So you have to increase the number of controls. And we'll see this issue in the later part of the discussion. Yes, very right. So when the number of cases are fixed, and because of many reasons, you cannot increase the number of cases. So one solution is to increase the sample size, is to have more number of controls. And we'll see up till what number you can increase the number of control. In this case, you cannot take 500 controls and 1 cases. Means 1:5 control, there's no point because it doesn't lead to a increase yield. So we'll see this concept, but just remember that this point we have discussed it here, that if there is a difference of only 0.5, that too in context of 1.5 and 2, then the sample size requirement will be 3 times. And if the sample size is less, although odds ratio is significant here, odds ratio is 1.5 here, but it will not be significant. So this you will see often in case control study. Many students also come to us like with having a cases and control, and their odds ratio is not significant. So a very important reason is their sample size, which they have calculated, or means like cases and control, which they have taken, it is less. So that means the power of study will not be that much to detect that difference significantly, that odds ratio as a significant yield. Am I making sense to all of you? Are you getting what we are talking? Okay. So now coming to the calculation of sample size for binary exposure. So basically, like we have seen, like as an input, you can classify it as a continuous variable or as a dichotomous variable, means exposure present or absent. So in all these cases, we will use this formula. So you don't need to remember this formula. This is basically, if you are calculating your sample size, then you need to copy paste this formula in your manuscript or in your proposal, or if you are applying for funding, then also you need to give this formula. So basically, if I come over this on first part, you know that this is the Z value, Z1 minus alpha. It is the Z value from the standard normal distribution corresponding to the 95% confidence interval, and the value is 1.96. Now, what is this P bar? So this P bar is the average of the P1 and P2. This is the pooled proportion. So pooled proportion is basically P1 is the proportion of exposure in the cases, and P2 is the proportion of exposure or the risk factor in the control. And if you take the average pool proportion, it is known as the P bar. So it is basically 2 multiplied by P1 minus P. You can remember it like many people write it as PQ. So that is also okay, but you should remember that this Q is 1 minus P. And this multiplication is the variance. Basically, if you multiply in case of this, in case of a mean, how do you define variance? You just square the standard deviation, or you measure the distance between the individual value and mean and you square it. That is the variance. In case of a proportion, how you calculate the variance? So basically your PQ by N, that is an under root, that is the variance. So here it is the under root. So basically this is the variance. And again this Z1 minus beta, If you see this is your value from the Z value corresponding to the that 80% of R. In this case, if you take 80%, the value will be 0.84. And it will be like 1.28 if you take 90%. And this P1, P2, again, this is P1, Q1, and this is your P2, Q2, or P2 in the bracket 1 minus P2. So this is the formula, and overall, if you take in the last, it is a square. So, and in the denominator, it is P1 minus P2 ka whole square. But you don't need to remember. Please don't, I am just showing this because you need to copy paste this formula if like you are making a proposal or if you are writing a project for funding. So this is the formula which is running in the background. Now, many times what happens that if you have one odds ratio and one proportion, then you can calculate the second proportion using this formula. Again, this is only for academic purpose, just for knowledge we are showing this. In any software, you don't need to convert the P2 using this formula. But just for many times you get these questions in a PG exam, assessment exam. So in that case, you should know that the odds ratio, basically, it is in the numerator, you take the proportion 2. That means in the cases. And in that case, you multiply it by 1 minus P1. That is the Q, which we were Q1. And then in the denominator, it is P1, 1 minus P2. So this is the formula. I'm not going into the details since it is not required, but just for knowledge, if you have got one proportion and one odds ratio, you can calculate the other proportion, means P2 or vice versa. Now, what input you need for comparing two proportion? So you need, since you have got two groups, there is there's a group of cases and there's a group of control. So you need basically the expected proportion of exposure in the control group, and you need the expected proportion of, if you can have an expected proportion in the group 2, or you can have an odds ratio also, depending on the input what you have. And then you can calculate. Desired power, you can keep it at 80%, anything more than equal to 80%. You will see that many people, they keep it at 90%, 95%. And then the other is the level of significance. So level of significance, generally you keep it at 95%. And then again, it depends on the alternate hypothesis, one-sided or two-sided. Generally, we keep two-sided hypothesis. Group size is basically you want to keep it like 1:1 or 1:2, like ratio between the case and control. That we mean by the group size. And design effect and response rate, it's important because design effect, I said that if you are doing a multi-centric study, a hospital-based case control study, then the hospital will be acting as a cluster. So that concept which we did yesterday, how to calculate this design effect, that you can apply. And then response rate, you have to anticipate. If it is 100%, that's okay. But if you are expecting a lesser response rate, then you can multiply with the response rate, do the adjustment. And then we always do the adjustment for continuity correction. So what is the adjustment of continuity correction? So basically here we are calculating the sample size formula using a categorical variable. So if you do a calculation using a categorical variable, you apply, because the assumption which all these formula that is based on, that your variable is a continuous in nature. So especially it should be done when the sample size is more than 100. So you should always adjust for continuity correction, and it gives a slightly higher sample size than any other way. So you should go for this continuity correction. So now let's see this with the one of the example. So this is one research question. Is poor glycemic control is associated with the development of diabetic retinopathy among diabetic patients in a hospital? So what is the exposure here and what is the control? Yes, what is the exposure here? All of you? I just keep checking in between whether you guys are attentive or... So diabetic patients, poor glycemic. So poor glycemic is the exposure, true. And diabetic retinopathy is the outcome. Very right. So to assess the association between the poor glycemic control and the development of diabetic retinopathy among diabetic patients. So you can scan this to see the reference article. If you scan it, then I'll I'll click this one so that I can see what is the input, because you should know how to extract input from article. So if my reference is this, and this is my reference article. If I click this, so this is my reference article. So this article got published in BMC, and you can see the title is Determinants of Diabetic Retinopathy in Southwest Ethiopia. A facility-based case control study. So here, if you see the result, they have taken 106 cases and 205 control. And the risk factor they have taken like family history, the microvascular complications, poor glycemic control. So if you see poor glycemic control, it is giving you adjusted odds ratio. But what we discussed, that we have to take the crude odds ratio. So how will I get the crude odds ratio? Because generally, what is the crude odds ratio? Unadjusted odds ratio is the crude odds ratio. So I'll have to go, I'll have to see the table. So if I start scrolling down, since I have already seen this article, so this measure is there in the table 4. So if I go to table 4, this is the table 4. Generally, wherever the author gives the comparison of this univariable and multivariable logistic regression, there you can find the unadjusted odds. So here you can see the person has given the crude odds ratio also. This is the crude odds ratio of 6.87. But since it is only, you need the proportion. Why? Because at least one proportion and one odds you need. So if you see this like glycemic level, so 80, this is the cases. So if poor glycemic control, 63.2% of people are there in the poor glycemic control in cases, wherein in control it is 20%. So this is how you have to see the input. So it is a very important task to see, because ultimately if you figure it out what to enter, then you can calculate the sample size very easily. The most important thing is to select the input from a reference study. And from a reference study, it may not be always be there in the abstract or write-up. Most of the time you have to see the table, because in table you can see these values, even the standard deviation and all. Many times if you are calculating mean, because standard deviation is generally given as a bracket or plus minus. So you have to see the table to get the values or to get the input. So in this case, you can see what will be my P1. So if I take my P1 as cases, so it will be 63.2% of poor glycemic control in cases, and in control it is 20%. So that's the, if you see the input. So this is the, to assess, this was the article. So if I go, so there were so many determinants. There are many determinants of diabetic retinopathy. You can see age is there, illiteracy is there, poor adherence to medication is there. Then there is a family history of diabetes and the presence of other microvascular complications, poor glycemic control, systolic hypertension, and duration of diabetes. So now there are so many risk factors. So which risk factors? So how should I calculate the sample size in this case? So there are two ways. There's one ideal way and there's one practical way. So ideal way is like, generally people say that you should calculate the sample size using all these risk factor, and the risk factor showing the largest sample size, you should use that much sample size. But if you think that all the risk factor or all the exposure status are important for you, but if you think no, like if your research question is specifically on poor glycemic control, then you can go especially for the poor glycemic control, and then you can calculate the sample size. Since you will get all these proportions, generally these proportions P1 and P2, they are there in a table because they show the proportion of these like family history of diabetes in cases and control. So you can get these values easily. But again, like I said, if for you it is not, all the risk factors are not important, then you can only take the poor glycemic control and you can calculate the sample size. So that is the thing which we have written in this case. So the similar input, I have used it here. So this 20% and 63%, remember, we have seen in that table. So the poor glycemic control in patients with diabetic retinopathy is 20%, and poor glycemic control among patients with means in patients with and without diabetic retinopathy is 20% and 63%. The power we have taken as 80%, the level of significance at 5%, and we have taken a two-sided hypothesis, and group sizes like ratio of cases to control we have taken as 1:1. So if I have to calculate sample size, how will I go? So I'll open this Statulator. So since we have discussed this Statulator, you can just type this in the Google and it will come. And if you click this, you can see there's an icon here, sample size. So there is an estimation of a single proportion, which we have seen last time. Then if you have to compare two independent proportions, so in this case, it is the two independent proportions. So I have clicked this. If you come down and see the input values, so this is the expected outcome proportion in the reference group. Now you can see it is writing expected outcome proportion. So take it reverse, because here you are starting with disease and you are seeing the exposure. So basically it says that what is the exposure proportion in the control group? We mean this by like sentence is something like, you will always think that it is for the cohort study because it is saying expected, but it is already there. So you can write here that you can imagine that they are talking about what is the proportion of exposure in the reference group, and reference group is your control group. So what was that? It was 20%. So 20% is already there. And what was the expected outcome proportion in the test group? So what was the poor glycemic control in the test group? That means in the cases, it was 63%. So I'll make it like you have to drag it. So I put it as 0.63. And then I'll go and press this calculate. So it is 22. You can see the option. This is getting calculated at 80% power, 5% of level of significance, 5% alpha error, two-sided hypothesis, and equal group size. If you wish to change any of these, then you can click on change. If you want to do it on a 90% power, you can drag this to 90. And then after doing that, you press update. Then you can see it is the 27. And then just see the write-up also. Because many times what happens that this Statulator, this doesn't get activated after clicking this option. So the sample size, it will show the prior one. But if you see the write-up, it is writing that assuming the 20% of the subject in the reference population have the factor of interest, which is the poor glycemic control, after applying the continuity correction. And continuity correction, if you see this adjustment, come to this adjustment, it is already ticked. So generally it is clicked if you don't want, but generally we recommend to have this continuity correction. And you can see there's a question mark. So if you just hover it around, you can see what is continuity correction. So it is writing that continuity correction is used because we use the property of a normal distribution to calculate sample size for a binomial distribution. Remember, we have categorized this as like present and absent. So this is for a binomial. So that's why you do it for a continuity correction. And then clustering we have discussed, and then response rate. So response rate, if you want to have like 75% and all, you can update it. But since I'm not checking anything in this, so I've just I've changed the power and make it as 27. So this is how you can go with the sample size calculation. Now coming to, it has come. So how to do the write-up? So basically the write-up, you can use that template which the statulator also gives. That also gives a, like you can just replace the exposure status and the outcome there. Otherwise, you can write like to determine the necessary sample size for the study on association between the poor glycemic control and diabetic retinopathy among diabetic patients. We have taken a reference. So you have to give the reference study also. So I have taken the study of Garema et al. And the expected proportion of poor glycemic control among patients without diabetic retinopathy was assumed to be 20%, while for patients with diabetic retinopathy, it was assumed to be 63%. So we chose a 80% power and a 5% level of significance for two-sided hypothesis test. And with these parameters, the calculated sample size for our study is 22 per group. So you need to have, if you are planning to select 1:1, then you need to have 22 cases of diabetic retinopathy and 22 control of patients without having diabetic retinopathy. So this is how you will do the write-up. Now coming to another research question. The research question is hepatitis C virus infection is associated with the development of a oral lichen planus among patients attending XYZ hospital? So Dr. Pava is asking what should be the ideal reference study since many studies with varied result may be available. Yes, so ideally you should take a recent, see there is a hierarchy in this. So ideally it should be from your local, like if I'm doing the study in Bihar, so I'll take a reference study if any reference study is there in Bihar. If any reference study in Bihar is not available, then I'll go for a study which is in East of India probably. If in the East also, if it is not available, then I'll go for a study in North. If it is not there, then I might take from South also. And then if the study is not available in India, then I'll go with the Southeast Asian region. And then if it is not there also, then I'll go for any study in the geographical region, if anywhere that is available. So that's the hierarchy. It should be from very much similar to your population. First criteria is this. Second is if in your population, like if say in Bihar also there are 3-4 studies, which study I should choose? So then you should take the study where the calculated sample size is the highest. Because if your sample size is high, then definitely the lower differences you will detect. So that's the important criteria. So then you can write in your write-up that you have calculated the sample size using 3 reference study and the maximum sample size you are getting from this reference study. So that's why you code that and you go ahead. Is it clear? Can you show me the messages? Okay. So now coming to this research, so is hepatitis C virus infection is associated with the development of oral lichen planus among patients attending this hospital. So my primary objective is to assess the association between the HCV virus infection and the development of oral lichen planus among patients attending the hospital by comparing the prevalence of HCV in patients with this oral lichen planus, which is the cases, and without oral lichen planus, which will be the control. So this is the QR code. You can scan this and you can see the article. I'll just click this to see the reference article. So if I see this here, you can see this is the reference article of Stefano Petti, and the title is showing the magnitude of association between the hepatitis C virus infection and oral lichen planus. So here again, like last time also discussed, that you can take the value of meta-analysis also. But here, if I go down, here also you have to see the table probably. So here in the table 3, it is showing the odds ratio of hepatitis C virus infection among case patients relative to control patients. So if you see the HCV prevalence, so prevalence of HCV in control patient, it is 0.81%. And if you see the case, it is 0.97. And this is the odds ratio is 1.1. So since we are using this, you can use any of the proportion, but in this case, we have used it in the cases. So you can either use 0.97 and 0.81 also as an input value. So if I go and see this, so I've used this 0.97 as the prevalence of HCV in healthy population. If I go and see this 0.97, and this 1.2 is the odds ratio. So if you calculate the sample size, so remember it is 0.97 and 1.2 is the odds ratio. So if I have to go to Statulator, so here you can see that this is the expected outcome proportion. What was expected? It was 0.97. So I'll use 0.97 as 0.01. Because it will be like if you 0.97, if you like convert it into value, then it will be 0.009. So 0.009, I am taking it as 0.01. And then measure of association, you can see it is, if you click this measure of association, then you will see three things here: difference in proportion, relative risk, or odds ratio. So since I'm using odds ratio, so odds ratio was 1.2. So if you click this, you can see it is 44,691. So since the prevalence is so low, you need to take these many samples in your study. So how you will do the write-up? Again, in this case, it is a similar way, the way we have written for the last example, to determine the necessary sample size for the study on association between the hepatitis C virus infection and the development of oral lichen planus among patients at XYZ hospital. We have taken the reference of that study, which I've just shown, and the prevalence in the healthy population was 0.97 and the odds ratio was 1.2. So at 80% power and 5% level of significance, we have calculated this much sample size. Now it is for you to practice. So you have to calculate the sample size. The research question or the title of the study is the study on the effect of improved water supply on risk of diarrhea. Again, just a simple question. What is case here and what is exposure here? All of you, please write in the chat box. What is the case here and what is the exposure here? Can you show me the message? Your case is the diarrhea and exposure is the improved water supply. So the sample size for this study was calculated. You have to see like proportion of poor water supply. Yes, right, Dr. Bhaskaran. It is the water supply is the exposure. So proportion of poor water supply in the non-diarrheal cases, that means in control, it was 70%. And the odds of poor water supply among diarrheal cases, it was 1.5. You have to calculate this using 90% power, 5% level of significance, taking equal group sizes, and anticipated response rate of 75%. Yes. So all of you, please calculate this. I'm also doing side by side. Let me write the values. So 70%, 90%, two-sided, and 75%. So I'll go to Statulator. So expected proportion is 70%. So I'll make it as 0.70. And then here I have to take the odds ratio. Odds ratio was 1.5. And I have to do the adjustment because I have to calculate it. So if you like press calculate, it is 523. But I have to do it at 90% power. So if I keep it at 90, This is the 90% power. Rest everything is same. And then you have to press update. So it is 691. But if you have to adjust it for the response rate, then make response rate as 75%. And then again press update. But you will see that if you press this adjust, then again this option, this power of 80% will come here. So this is a bug in the statulator. So again you have to increase it to 90. So you'll have to do this twice. And then you can see it is calculate. Oh, I forgot to press update. That's why I'll just press update. And then you can see it is 90. Just read this. At what power it is yielding. So it is at 90%. So total sample size is 916. But 916 is again in each group. So it is 916 and total sample size is 1826. So this is the same question. Remember where we were discussing the 600 sample size. This we have taken that examples where 70% of the cases were of like improved water supply, poor water supply, sorry. Now again, there's another question. That study of association between vitamin A deficiency and risk of diarrhea morbidity. So in this case, again, the cases will be your diarrhea and risk factor or exposure will be the vitamin A deficiency. So now all of you calculate this population or the control suffering from vitamin A level deficiency is 10%. And the odds ratio of vitamin A deficiency in diarrheal cases is 3. So you have to calculate it at 90%. But again, control to case ratio is 4:1. So what will be the sample size? Yes, all of you, please do it. Let me see if previously somebody has did it or not. No. Are you guys not doing it? You can do it if you like. Okay, then again, you can do it at home if you do, like if you are attending from a mobile or only from one system because you need two systems. Or in this case, then I'll show you how to do it. So it is 10% and 3. So I'll go here. The expected outcome of this reference in the population is the 10%. So I'll make it as 10. And if you see the odds ratio was 3. So if you calculate this, it is 143. But I have to adjust it ratio of 4:1. So this I will not use this. And then I'll go to option. Here I have to increase the power to 90% because I have to calculate it at 90% power. And then the second option I have to use like group sizes. So you can see that ratio of reference to test group means control to cases. So I have to make it 4. And then I will update this. And then you can see the calculation of sample size. So it is 107. But 107 is the cases. Total is 428 is your control. So a total sample size will be, if you see this, 535. So the total sample size is 535, taking 107 cases. So this was the maximum ratio of control which you can take. That is the 1:4. We'll see why it is so. So Dr. Pallapalli has till how much difference is allowable in each group? Is it okay that one group has 913 and other is 450? What is allowable? Is 4:1 is a standard reference? Okay, so I'm coming to your question. Just wait. I think this was the point. Maximum we take 1:4. Because there is no point taking 1:5 because then you don't get a yield taking more controls. So we'll see how you can achieve this. So what to do when you have already fixed number of cases, like in the diarrhea cases, or many times in your records, you have got a fixed number of cases, or like outbreak investigations, you have got fixed number of cases. You cannot increase those cases. So what to do if your calculated sample size is coming much more than if you take 1:1 ratio? So like in this case, you can see that this is just example that a study of impact of hygiene education program on risk of diarrhea morbidity. So the investigator is constrained by the need to complete. So if your study, you need to complete it in a short span of time, and you are not expecting those many cases, then you can do this. Or like in case of outbreak investigation, you can do this. So this was a sample size calculation, which we did using the 60% of population not educated for the diarrhea prevention program, taking the odds ratio of 2, the desired power was 95%, and 1:1 ratio. If we have calculated the sample size, then what is the calculated sample size? So all of you, please do this. So if like there is 6-month time is there, and 60% is the population which is not educated for the diarrhea prevention program, and 95% is the power. So if I go and calculate this using Statulator, so you can see it is the 60%. So I've dragged it to 60, like 0.6, and odds ratio is 2. So I made it at 2, and option is you have to increase it to 95%. So I've increased it to 95%, and since ratio, I don't have to take 1:4. So I kept it like 1:1 and update. So I need to take 261 cases. You can see I need to take 260 cases, and the total sample size was 522 if I take equal group sizes. But I have only 180 number of cases. So how to do a case control study in such cases? So in such cases, what you can do, you can increase the number of sample of control. So how to achieve that? So basically, normally the case control ratio is 1:1. But when the available number of cases are small, or the investigator, you as investigator, you need to finish your study in a short duration of time, then you can increase the number of control. And by increasing the number of control, you can reduce the number of cases. So this required there's a formula, which is the C plus 1 divided by 2C multiplied by N. This is the formula of the required number of cases, and this N is the case. So you have to multiply with this to reduce the number of cases. We will see that, how to do that. But this reduces the number of cases maximally by 50%, not more than that. And there's no gain in recruiting more than 4 controls per cases. How? We'll see this. So see this, we are calculating the adjustment factor. So this is for the one, if you are taking 1:1 control, then this will be the number of control will be the 1. Sorry. So how to calculate this adjustment, this factor by which you have to multiply? So 1 plus 1 divided by 2 into 1, it will be 1. So you have to multiply this to the number of cases which you have calculated earlier to get reduce the number of cases. Similarly, if you take 2 controls, your adjustment factor will be 0.75. Means you have to multiply the calculated sample size by 0.75 so that number of cases will be reduced. Similarly, if you are taking 3 controls, then you can reduce the number of cases by 67%. That means you have to multiply your calculated sample size of cases by this 0.67. Then you can get a calculated sample size. Actually, we are showing this. You don't have to do this, but you should know how this, like you have asked this question, up till what control you can take. So it only depends what is the available number of cases you have. And then again, if there are 4 controls per case, then your multiplication factor is 0.62. Similarly, if there are 5 control, this you can see 0.60. So beyond that, you can see like 0.60, and then it is 0.58, but it gets stuck at 0.5. Even if it is 10 control, after 0.6, you can see there is very little gain in the number of reduction in the number of cases. So generally, even if you increase that beyond 4, it is not recommended, because ultimately if you are taking more control, then it is adding to your resources also. So if you will not get much of the yield by increasing the control, because after this 6-2, it is again 60%. There is no much increase in your, decrease in your number of cases. So how do we calculate? So basically the calculated sample size, what we calculated, it was 261. And your number of cases which you have was 180. So you divide 180 by 261, it is 0.67. So then you can see, like, you can match it with that correction factor, and you can see like 0.67 corresponds to 3 control. So you should take 3 control per case. So that's how you calculate how many controls you can take. Again, it depends on the number of cases you have. So you keep on increasing the control till you get the number of cases which you have. Like in this case, it is, if you take 3 controls, then your calculated cases will be like decreased by 0.67, which is 180 in this case. Have you understood this? Yes? Can I see the chat? Or should I repeat this? Okay, yes. Thank you. So coming to the this we have done when there is a categorical variable. That means you have categorized the cases having the exposure present, exposure absent. When your exposure is in the continuous variable, which is not always there, generally in case control, you have got 2x2 table. And you generally categorize your exposure status as present or absent. But in few situations, when your exposure status is as a continuous variable, then again, you have got few options. Either you can dichotomize the variable in order to use the previous equation like we have seen. But again, if you are sure that by dichotomizing, you are going to lose your data, because we know that a continuous data has got more validity than a categorical one. So if you think that making categories is not a good option, then you can use the formula of mean as a input. And again, like we say that dichotomization of a continuous variable, many times it leads to a decrease in the, you can say like effect, or it obscure the result. So that's why you don't want to reduce that power of your data variable. So that's why you can use the continuous exposure. So in that case, you can use the mean as a formula. And this is the formula. So this, you take the pool standard deviation and then Z beta and Z alpha by 2, where the values are 1.96 and 0.84. And then in the denominator, it is the expected mean difference between the cases and control. So what input do you need if you want to compare the two means? So again, like we did for proportion, so you should have a mean of exposure in the control group. You should have mean of exposure in the cases group. And then you need the standard deviation, which is the pool standard deviation. And desired power, we keep it as 80%, level of significance at 5%. And again, adjustment, you can do like alternate hypothesis, group sizes, design effect, and t-distribution. So now let's do the calculation. So this is one example where the author is trying to see the association between the relationship between the shoulder impingement syndrome and thoracic posture. So in this case, what is the exposure and what is the outcome? So if you see that this shoulder impingement syndrome is the outcome and exposure is the thoracic posture. So that exposure, the person wants to measure the exposure in the form of an angle, which is known as the Cobb's angle. You can see. So he's thinking that there will be a difference of 5 degrees in the modified Cobb angle, and he is taking a pool standard deviation of 10 degrees. So what input are we using? So in this case, you can see the difference between the mean difference between the modified Cobb angle between group is 5 degrees. The standard deviation pool is 10 degrees. Again, the power is 80%, 5%. This is like usual thing. So I'll go to statulator. and then I'll use the formula for mean difference. So if you come and see the sample size, you can see here is the option of compare two independent means. Can you see this? Here you can see this is the option of comparison of two independent means. So I'll use that. I'll click this. And then expected means or expected difference. Since I have got the expected difference, so difference between the two angle is 5 degree. And if you see the pool standard deviation, it is the 10. So if you calculate the sample size, it will be 63 in each group, having a total sample size of 126 because I am taking 1:1. So this is the regarding a continuous exposure. If I am having a exposure which is continuous in nature. So again, one question for you guys. So this, you want to see the association between the birth rate and diabetes in adulthood. So again, cases are the birth rate is your diabetes in adulthood. So your diabetes is a case and exposure is your birth rate. So your sample size of this study will be your expected, this input you are using. So your expected difference between the two group is 250 gram, that is the birth weight, and the pool standard deviation is 1000 gram. So how will I calculate this? I'll again go and then here I can see the difference is 250 gram and here the standard deviation is 1000. So if you pool standard deviation, if you calculate this sample size, you can see this, there will be 252 in each group. Now coming to, I said that this generally we discussed for an unmatched case control study. For a matched case control study, generally what you do, you select controls based on your case. So for each case, you select a control simultaneously. There is a difference in process of selecting control for a matched and unmatched. So for matched case control study, generally, if you need the correlation between a confounding variable for your cases and control. So Statulator doesn't give you formula for a matched case control study. So basically what happens in matching, because if there are confounding variable and if you don't match, so there is a reduction in power. So that's why calculation of sample size should be done using a different formula. Generally, it should not be there using this Statulator formula. So if you go to this, last time we discussed about this this Cleveland. Remember this risk calc we discussed. So if you see this here, if you click this case control study, unmatched you can do with the Statulator. But matched case control, these are the thing, the 5% error rate, power that is same 1:1. There is a new, and this P1, P2 is also the same, the way you have done with the Statulator. But if can you see that there's a R here? So this R is the correlation between the cases and control. So you need this correlation to calculate the sample size. But if you don't have, then you can assume also. So generally, if you think that there is a moderate correlation between the cases and control for a confounding variable, then you can put it as like 0.3 or 0.4. If you anticipate that it is of a very low correlation, then you can put it as 0.1 also. So if you like press here and you can hover it here also, it is writing that correlation coefficient for exposure in matched pair of case control study. So there what you do, like you can calculate it also if you have got a pilot study. So you can calculate this correlation coefficient from your data and then use it for the calculation of sample size for rest of your study. So you need this 0.3. And if you calculate this using this formula, so then you can see that if the proportion in one group is 40% and in the other group it is 60%, then you need 78 cases and 78 control. If this correlation coefficient between the two is 0.3. So in case of a matched case control, generally, like if you don't use this formula, then what will be the sample size? You can see the difference. If I calculate the sample size, so right now, the sample size using this is like 40 and 60% is 78 in each group. But if I go and do it with the unmatched one, with the 40 and 60. So here you can see 40 and 60, and if you press calculate, it will be 107. So generally what happens? The calculated sample size for a matched case control is less as compared to a unmatched case control. So unmatched, you can see it is a 107. Whereas in matched, what was the number? It was 78 in each group. So if your methodology, but generally the matching which you people write, that is not the way we match. That is epidemiological issue which we are not discussing here. And analysis also, there's a different way to analyze that matched case control study where we put conditional logistic regression, and the data entry is also differently done in case of a matched case control study. So yes, if you want to use a methodology of a matched case control study, then you should calculate the sample size using this RiskCal, where you have to put the value of correlation coefficient, which is this R, and then you should calculate the sample size, because your calculated sample size will be lesser than what you calculate for a unmatched study. But still, if you don't want to calculate using a matched pair, then even if you do it with unmatched sample size, it will test the hypothesis, because that unmatched is great. Number is more than a matched control. So even if you used a formula for matched one, unmatched one, then also it will satisfy the sample size for a matched one. So this is how the matching is important. So if there is a strong confounder, it may increase the sample size up to 70% if it is needed. So stay connected with us. And in the next month, October, we are meeting on 8th of October. Which link is showing error? Okay. Okay, so question, I think, have we answered the questions? I think we have answered the questions in between. So thank you, everyone. That's it from my side.